Hello students, I'm the OGGuru. Welcome to the channel and I'm here with a single point agenda to make OBGY your most favorite and your most scoring subject. So with the MBBS university exams round the corner, theory and practicals, I thought I will do a session which will help the final MBBS students in their Viva. These are the most important Viva questions they are going to be asked to you. So make sure you are very well versed with them and this is really going to help you in your crack the Viva examination. And before that, all of you can get in touch with me on phone and WhatsApp on this number. Download the OGGuru app. I'm happy to announce recently the OBGY practical and Viva course where I'm going to teach you how to do history taking, the GPLA system, examination of the patient, LMP EDD calculation, instruments, table Viva, drugs, gynecology cases, contraception, and of course my doubt solving and mentoring. So it's a complete course and this is a 3 months package available only in 1449. It will really help you crack the examination, Viva examination. Students have got gold medal and distinction in the university exams listening to these videos. And those who want to rapidly, there is a theory and practical. So this has got theory classes where you can finish off very rapidly. You can write your university theory answers based on this video lectures, and this includes theory and the practicals what I have already mentioned. So get in touch with me. The final year students, do not waste time and join soon, and you will be able to do very well in your university theory and practical examination is my guarantee. Now let us begin today's session. The first important is a very common drug. What is it? Yes, it is Sir Oxytocin. So now when you pick up the ampule of a drug, don't just say this is oxytocin and stop. Start talking. Rajdhani Express. Don't let the examiner ask you, okay, what is it? How is it? So you pick up the drug and whatever 3, 4, 5 lines you know about it, you rattle it out. The examiner knows that this student is well prepared. Then if he wants to ask you some questions specifically or other questions, then he or she will ask you. So just don't pick up, sir, this is the ampule of oxytocin and keep it down. No. Okay. So now, yes. So this is the ampule of oxytocin. One ampule is how much, students? One ampule is 5 units. Okay. One ampule comes in 5 units. Okay. One ampule is 5 units. Now, oxytocin is very important drug because it's a basic drug. If you don't know this, you might not clear the examination. Now there are different uses of oxytocin which we should know, and also you should know that as per the doses, the action of oxytocin will change. How? I will explain to you in 2 minutes. Now, one more very important drug, and we discuss both the drugs together, and this is the second drug. Anybody, what is this? Yes, sir. This is Methylergometrine. Methylergometrine, popularly known as Methergin. Again, a very common drug kept on your Viva table. You have oral tablets, but that is hardly ever used or very rarely used, and mainly the injections are available for IM and IV use. Now, can anybody tell me what is the difference in action of oxytocin and Methergin? So we are discussing both the drugs together. So can anybody tell me the basic action? Okay, these are uterotonic agents. They make the uterus contract. So both oxytocin and Methergin is going to make the uterus contract. But what is the difference in action? Can anybody tell me? Okay, so yes, please understand this. That sir, okay, this is the uterus, this is the baby inside. Now what does oxytocin do in normal doses? What is the meaning of normal doses? I'll tell you. Okay, sir, when I use it for labor, okay, when the patient comes to us and I want to either induce the labor and mainly augment the labor. Okay, augment the labor means, okay, sir, there are contractions, but the contractions are not strong enough. I want to augment the labor. That time we will give patient 5 units, but always diluted. Never IV bolus push. So it has to be diluted. Okay, so you dilute it in 500 ml of saline. 5 units we give IV, and that also titration. Why? Because धीरे धीरे oxytocin action, so धीरे नशा चढ़ा धीरे धीरे ऐसा. You cannot give suddenly too much oxytocin. Why? Lot of contraction, there could be excessive contraction, fetal distress, all that complication. So I have to do titration. That means what is the meaning of titration? Sir, initially we start by 8 drops per minute. All this is going to get you distinction, my students. Okay. Then you increase this to 16 drops. Then we increase it to 24 drops. Then 32 drops, like that. So this is called as titration. Okay. The details of the doses will not be asked to you. But remember, 5 units IV we give it, diluted drip. Okay, diluted drip, and we give it titration drip. That is to augment the labor. Augment the labor matlab ke make contraction more stronger. Now, what will oxytocin do? Sir, oxytocin will cause the upper segment to contract and the lower segment to relax or dilate. Okay, so the upper segment will contract, the lower segment will dilate, and then only the delivery will take place. Yes or no? So the upper part has to contract and the lower part has to dilate or relax. The cervix will keep on opening. So please keep in mind that is the action. So you can see upper segment we are drawing the contractions and lower segment is going to dilate, and that is how the labor and delivery will take place and the baby will be delivered out. Okay. Now can anybody tell me what will Methergin do? Yes, sir. Methergin causes a strong tetanic contraction of the entire uterus. Both upper and lower segment will contract together. And therefore, please understand, I can never give Methergin to a patient while the baby is inside the uterus. What will happen? Yes, sir, the whole big gravid, imagine, the whole big gravid uterus will contract against the closed cervix because both upper and lower segment will contract together, and there will be rupture uterus fetal distress, and you will have to go to jail for double murder. Okay, so please understand this jail. Why? Because mother dead, baby dead, rupture uterus. Okay, so please understand this, that Methergin can never be given while the baby is inside the uterus, and therefore remember that Methergin has got one and only one use. Only when the baby is out, when the baby has delivered, can I give Methergin, because Methergin has got one and only one use in obstetrics, that is prevention and treatment of PPH, postpartum hemorrhage. So my dear student, final year students, warning: if you pick up the ampule of Methergin, and say, okay sir, I will use this drug for induction of labor, fail on the spot, cardinal mistake. Examiner will say, okay beta, keep the drug down, get up, go back out, come back after 6 months. You do not even know the basics of obstetrics. So please remember that Methergin is never for labor induction and labor augmentation purpose. It is only for one thing. It is for management. You can write it prevention and treatment of postpartum hemorrhage. Okay, Methergin is only for PPH. Either we give it prophylactically also for prevention of PPH, or even when actual PPH is happening. And therefore, I can only give once the baby is delivered. Okay, once we have delivered the baby out and the baby is out of the uterus, then I can give Methergin. Why? Because I repeat, Methergin is going to cause contraction of both upper segment and the lower segment. So both upper and lower segment will contract together, and that's why it is a uterotonic agent. If you want to make it further strong, it's called a ecabolic agent. Okay, ecabolic agent. Okay, ecabolic matlab a uterine stimulant. Okay, it's a stimulant. So uterotonic agent. So Methergin, my dear student, the difference is very important. We should know, okay, sir, oxytocin is going to cause the upper segment to contract and the lower segment to relax or dilate, and therefore I can use it for delivery. Whereas the Methergin is going to cause both. It's going to cause both upper segment plus lower segment to contract, and therefore I can use Methergin never for induction of labor. Never. We use it only for one and only one purpose, PPH. Clap if you have learned something. That's very, very important. Please don't make a mistake. Okay, but one more point. The same oxytocin, sir, the same oxytocin, if I now increase its dose, how much I will tell you? The same oxytocin, now if I increase its dose, its action also becomes like methergine, and it can also be used for PPH. So oxytocin, sir, one, I can use it for induction and augmentation of labor, and second, I can also use for PPH. Okay, that time how many units we use? Yes, again remember 20 units. Okay, 20, 30, 40 units. Okay, so generally 20 units, that means 4 ampules, but again always remember diluted, never IV bolus push. Okay, never. Okay, I can never give oxytocin to a patient undiluted bolus. That means I can never open the ampule, take the oxytocin and give it IV push. Okay, so never IV bolus. Okay, bolus means a push. Okay, it has to be even when I'm giving for PPH, and remember 20 units if you remember is okay. Okay, 20 to 40 we give, 20 units we give, that will again be diluted IV. Okay, IV drip, you dilute it in saline, and that drip can be given fast, that is fine, we can give it rapid IV, but it has to be a diluted thing. Is this understood to all of you students? So this is short your distinction. I'm going to ask you this, I repeat, sir, oxytocin has a dual action. Sir, when I give only 5 units oxytocin, it is going to cause the upper segment to contract, lower segment to relax, and that is what I want for delivery, or that is what I want for induction of labor or to augment the labor. But when I increase the, and that is time we give it diluted titration drip, and when I increase the dose of oxytocin to 20 units, then it can be used for PPH management, prevention, PPH treatment, because then, sir, at 20 units the action becomes like methergine, and it will cause both upper and lower segment to contract, which is the purpose of, or which is the management of PPH, because I want the whole uterus to contract. So remember this, student, oxytocin has got dual thing, and methergine has got one and only one use, which is your PPH. You cannot, so methergine comes in front of you, you have to say, sir, this is only for PPH, because it causes both upper and lower segment to contract. Okay, both the upper segment plus the lower segment is going to contract. Is this understood to all of you? Basically it is going to cause the entire uterus to contract, both upper segment plus lower segment will contract, and that is how it is going to help us in PPH. Okay, so please never say methergine or methylergometrine for induction of labor, you are going to fail. Okay, and the last point, do comment in the chat box, all of you. Oxytocin, I told you, one I have told you is 5 units dose, second I told you is for PPH, and please comment in the chat box, all of you. I'll give you the answer that oxytocin is also used for AMTSL. Very important. What is AMTSL? Active management third stage labor. I repeat, it's the first drug of choice for active management third stage labor, AMTSL. Please comment in the chat box what is the dose of oxytocin and what route do I give when we want to do AMTSL, active management third stage labor. Please tell me the dose and the route in the chat box. I'll give you the answer, is my guarantee. Okay, so 5 units IV titration drip, and again for PPH IV diluted, rapidly fast we can give, but in a drip form, diluted drip. Okay, IV drip. Okay, never give it IV bolus. Why? Sudden crash, suddenly the hypotension and patient can collapse. So never IV bolus, it can cause sudden hypotension. Okay, so this is very important. We have covered 2 most important drugs. I'm sure you are loving it, and please get in touch with me on phone and WhatsApp on this number. I'll guide you further for your MBBS university preparations and also for NEET PG. Moving on to a very important instrument. Okay, so again, when you get the instrument, don't just say, okay sir, this is this, start talking. Okay, this is this instrument, it is sterilized by autoclaving boiling. What? Describe the instrument in one line and tell one. They are going to ask you where you have seen this instrument being used. 1 or 2 uses you should know very well. Okay, so what is this instrument, anybody? Okay, so here we have a catch, here we have a finger rest, and on this side we have got triangular solid blades. You can see we've got a triangular solid blades. okay, with serrations, okay, with serration. This is how you describe the instrument, okay. By the way, stylish, okay, normally students say, sir, proximal and distal and all that. Stylish way, this part of the instrument, which is going inside the body and basically doing the work, is called the business end, okay. So this is called the business end. So this is stylish, okay. Examiner immediately knows that this is a special student, Dr. Punit student, okay. Business end of the instrument, okay. So immediately you get more marks, okay. So sir, business end of the instrument has got triangular solid braids with serrations. Excellent, okay. Now anybody, what is this? Yes sir, this is the green Armitage forceps, okay. This is a green Armitage forceps kept on your Viva table, of course. And in which surgery have you seen this instrument being used and where? Okay, so mainly, my dear student, one and only one use. It is a very important instrument on my cesarean section trolley. I use it during LSCS. Now where? During LSCS, okay. So please pay attention. If this is the uterus, okay, if this is the uterus and we have taken a cut on the uterus and delivered the baby out, okay. This is the transverse incision I've taken. Now this is of course going to bleed and we are going to suture it. So till that time what is done is, okay, this instrument, the green Armitage, is to catch, we have to catch the angles, okay. So it is to hold the angles, okay. These are called the angles, okay. This is called the angle, this is called the angle because you're going to bleed. So I will apply this instrument over here, we will apply this instrument over here, the triangle part. So it is basically a hemostatic action. Till the time this triangle end is going to press the bleeding vessels and then I will start suturing it. So it is to hold the uterus, uterine angles plus the edges of the uterine incision, okay, during LSCS surgery. Of course, before we start suturing, okay. So this part is called the angles, okay. This is called the angles and these are the edges of the uterine incision. So you apply the instrument like this, the triangle part, of course, will go like this, you apply the instrument like this, okay, and it will hold the angles, so it prevents, because otherwise this whole part is going to bleed, isn't it? The angle is going to bleed. So it is a hemostatic action, okay. And then of course we suture the angle, we suture this angle, we suture it, and then of course once we suture is in place, we remove the green Armitage forceps. Alternatively, they'll ask you that, doctor, if suppose this instrument, so green Armitage forceps, one and only one use, if this instrument is not available, what another instrument can be used to hold the uterine angles and edges in LSCS surgery? Sir, Alice forceps, okay. So with one instrument, I have discussed two. Sir, Alice forceps can also be used in place of green Armitage forceps to hold my LSCS incision. Okay, I hope you are loving it and you will get the marks in your Viva for sure. Okay, moving on to the next important thing. This is kept as your spotter also, X-ray film. So this is what? So this is a contrast X-ray. And what are we seeing in this contrast X-ray? So this could be kept as your spotter or Viva, or they're going to ask you as your OSCE examination even on a Viva plates. Okay, so yes, this is a HSG, hysterosalpingography. It is a contrast X-ray. It is a contrast X-ray. And can anybody tell me why is it done? Yes, sir. It is done to check the tubal patency. Okay, this X-ray is done in infertility patients to check. It's a test for tubal patency. I'll also give you the tips to get distinction and gold medal by how to answer the HSG. Okay, so to check the tubal patency. One more Viva question for all of you. Please comment in the chat box which day of the cycle is this HSG done. Okay, if I give you a couple of options, sir, I would like to do it on day 2, day 3 of the menstrual cycle, day 8, day 9 of the menstrual cycle, day 14, day 15, or day 24, day 25. Okay, 4 options I am giving you. Please answer in the chat box or comment in the chat box when is the HSG done. Okay, which day of the menstrual cycle? Which day of the menstrual cycle is the HSG done? Options: day 2, day 3, when the patient is actually bleeding, day 8, day 9, day 14, day 15, or day 24, day 25. Which day the HSG is done? Okay, now all of you please pay attention what we see in the center. Okay, what we see in the center. I'll also quickly zoom and show you also one more time so that all of you can see it. Okay, so what is this? Okay, what is this what you are seeing in the center? Okay, so this is what? This triangle part. Just keep observation. What is this? And then what is this one line? What is this one line? What is this one line? I'm going to show you. And then what is all this? What is all this? Okay, what is this arrow? So this is how you describe your HSG. Okay, so it is, please pay attention. It is, remember, we will see the uterus first because it's a hysterosalpingography. So the normal uterus is triangular cavity. Okay, it's a triangular cavity. You have to say, sir, it's a triangular uterine cavity we can see. So this part what we are seeing is the uterus. Okay, uterus cavity, you can see triangle uterine cavity. Okay, so this is the uterus. And you have to say it is well opacified, there is no filling defects. Okay, it is well opacified and there are no filling defects. In case if it's a filling defect, you have to describe, sir, is it a solitary filling defect or multiple filling defect? Filling defect means, sir, suppose this is some kind of a fibroid or a polyp, then sir, everywhere else uske आजू बाजू में, sir, the dye will fill up, but rest of the place the dye will not, and because of that polyp or fibroid, the dye will not enter over there. Isn't it common sense? So you see a filling defect. Okay, so this is called as a solitary filling defect. Can you see so nicely? So sir, this how will you answer in your Viva? So the uterus, I can see a triangular uterine cavity with a solitary filling defect. Okay, suppose, but that's not the case over here. The uterus is well opacified, there is no filling defect. Okay, so what will I say? So sir, this part is a triangle uterine cavity, and sir, then this thin, nice, bouncy, wavy tubes you see. So this, my dear student, this is the fallopian tube, and this is also the fallopian tube, and you know the right tube. So this is the right tube and this is the left side of the tube. And then if the tubes are patent, what? So we are pushing the dye from the cervix. Okay, we are pushing the dye through the cervix, and then we will see the, what is it called? The spill of the dye. Many students don't know. Spill means normal. Spill is good. Spill indicates what? Spill of the dye tells you, okay, sir, the tube is patent. Why, sir? The dye I pushed from the cervix went all the way into the uterus. Then you click a photograph. So patient is on X-ray table and you cannulate the cervix with a cannula, and you put the radio opaque dye and shoot and take a shoot, and we take 2 to 3 shoots and we can see the dye coming out of the fimbrial end. That means the tube is patent. So this, my dear student, can you see all this thing which is over here? Yes, that is the spill of the dye. Okay, so triangle uterine cavity, the I'm writing fallopian tubes, this and this, left and right, and this all what we are seeing is the spill of the dye. So sir, this is a normal HSG. At your level, this much gives you distinction and gold medal. So at your level, only normal HSGs are expected. Of course, abnormal HSGs we discuss in detail in our theory lectures also, where it's a single solitary filling defect, multiple filling defects, and then if the tube is blocked. Okay, so suppose I'm just giving you an example. So this is a normal HSG. Now suppose, sir, this is the uterus and the dye is ending over here. Then I can say, okay, sir, right side the tube is mid-tubal block. And left side, suppose like this is the picture. So left side, so there is a proximal tubal block. Okay, so left side mein the tube is blocked at the core. This is called what? Cornual end. This is the cornual end. Okay, so if this kind of HSG is given to you, so triangle uterine cavity, left tube is not seen. So it could be a left-sided cornual block or a spasm, and right tube, sir, is only seen up to halfway or middle. So this is again, it's a right tubal block. So right tube is also blocked. We cannot see the whole tube. There is no spill, and the left tube also is not seen. Okay, so this is how you can get variations in your HSG. Okay. And finally, also comment in the chat box, which is this one more instrument. Can you tell me this instrument where you can see this like this, the serrations, which is this instrument used in HSG? Which is this instrument used in the HSG to perform the HSG? Okay, what is the name of this instrument to perform the hysterosalpingography? What is the name of the cannula? Okay, what's the name of the cannula? Okay, because with this cannula you will inject the dye. Okay, this is the valsellum. We hold the lips of the cervix with the valsellum. Okay, and one more instrument, we use a cannula. I want all of you to comment in the chat box what is the name of the cannula which is used to inject the radio-opaque dye during HSG. So triangle uterine cavity, left and right bilateral fallopian tubes are seen, and spill of the dye is seen. So this is a normal hysterosalpingography. So a lot of information. Please, my dear student, as I said, this is a very important thing, and students panic before the examination in your Viva. So make sure that with my OBGY Viva course, you are the most perfectly prepared for your Viva. You will be extremely confident, and when you go on the Viva table, get in touch with me on this number. I'll guide you, and you can install the app, and 3 months package only at 1449. History taking obstetrics. You will get the PDF material also for in-app viewing, instruments, drugs, and your contraception entire tray, gynecology cases, and of course your obstetric cases, and doubt solving and mentorship is available. And please, also master class has got beautiful theory lectures. You can write your entire theory answer. Like every video will have etiology, clinical features, investigation, management, treatment. So ready-made theory answers, long answers, short notes, all you will be able to write based on this theory lectures in the university exam, with how to write your answers and diagrams and all that. And of course the practical course is also there. Okay, so I wish you all the best for the upcoming exam season. Do get in touch with me. I hope this video was helpful and informative to all the final MBBS students, and best of luck, and see you soon.